Oral surgery was actually, for me, the whole reason I went to dental school. I did my dental school at the University of Florida in Gainesville, Florida, and then went to residency at the University of Iowa. Associated Oral Surgeons has been here really since the late 70s, and in this building specifically since 1980. I joined in 2008. And I've been here ever since, and it's been a good fit for me professionally. And in terms of the scope of the practice, in aspects of my training, I want to be able to continue in private practice. This has allowed me a good opportunity to do that. Conceptually, the idea of partnership with a private equity partner who has some capital to invest and help scale and grow was something we were aware of for actually several years, even leading up to the introduction. So, OSP at least rang more true to our practice philosophy and where we thought we were headed, and the group that we'd be interested in partnering with. 18 months into that, I certainly don't regret the decision. Our practice has always been patient-centered, patient-focused care, that being kind of like the highest common denominator, and then everything else trickles down from there. And of course, when you have doctors that have that focus and are patient-focused, I think that's how you keep outside entities, maybe that are more business focused from having a negative impact on your brand and what you've grown. And OSP certainly understood that, and that's kind of the cornerstone of how they've structured leadership within the group. And doctor autonomy and doctor leadership is a big part of what OSP is, and so that had a lot of appeal to us. You wear two hats. You have, your primary responsibilities as a surgeon and a caretaker of patients, and it's nice whenever you can distill your activities to that focused duty. That's I think everybody's kind of surgical nirvana, if you will. So being able to take things off the table, certain things like HR and staffing issues, and not that we don't still have a hand in those things per se. I mean, we hire the assistants we want, we hire the nursing staff we want, and the doctors have the final say and approval and all of that. But the day-to-day HR issues and staffing problems that come up with any organization now have centralized support, and that makes it easier for our boots on the ground office manager to deal with here. And it just makes those problems kind of, which were kind of daily kind of things you'd have to deal with and navigate, are now off the table. I don't have to worry about those, and that's time I can utilize to do other things, either related to my surgical duties or apply to home life and family, and it just creates a better lifestyle overall. The second part of that is when you own a business, you are also, you have to continue to reinvest capital and grow that business and keep up with changes in decor, equipment demands, marketing, surgeon recruitment, whatever the case may be. And those are all major capital expenditures. And I think too often what you see when you look across the landscape of private practice oral surgery is surgeons, as they get older, and that, that reinvesting that capital where they may not feel like they'll immediately realize the return or realize the return in their practice lifetime or their career lifetime, maybe makes them reluctant to do so. And so you see a lot of aging practices that maybe start to stagnate and lose value for that reason, and lose referrals and lose patient base. And then of course when they're trying to sell their practice, they get frustrated trying to understand why they can't realize the value of all the time they've put into making that brand and growing it. And I think, in a group practice, we've seen that element in our own practice from time to time. And so this became an opportunity to avoid stagnation, have a partner that's committed to capital reinvestment. And that capital reinvestment doesn't necessarily have to come out of your own paycheck anymore. That capital's there from a different revenue source and allows you to effectively continue to scale and grow your business without maybe making some of those, emotional decisions that while they may be temporarily fruitful, hurt you in the long run. And so that, from a business standpoint, I think there's a huge advantage when you look at the future of our profession and where things are headed and the amount of consolidation that's going on right now. to have that type of capital commitment that for the average small group practice or private solo practice would just be impossible to commit those kind of resources on your own. It's all rewarding at the end of the day. There's no such thing as unrewarding patient care. Everything we do impacts people, I like to think, in a positive light. And so being able to administer that kind of care, whether it's one time or whether it's over a course of time, is still a great, wonderful thing.